Welcome back to my channel. It sure feels good to be here again. And if you are visiting this channel for the first time, you are also highly welcome. In this lecture, we'll be looking at the true pelvics. The true pelvics can also be referred to as the lesser pelvics. Let's try and use this image here by the side to describe where the true pelvics or the lesser pelvics is located. This is the configuration of the pelvic bone, and within the pelvic bone is where we have the pelvic cavity. This pelvic cavity is further subdivided into two by the pelvic brim or the pelvic inlet, and this is what is highlighted here in dotted yellow. The region of the pelvic cavity that is located above this pelvic brim or the pelvic inlet is referred to as the greater pelvis or the first pelvis, and this is what is harrowed here in red. This is greater because it is located above, and it is the first pelvis because majority of the pelvic viscera are not located within the space, so it is first. While the space within the pelvic cavity that is seen or located inferior to the pelvic brim or the pelvic inlet is referred to as the true pelvis or the lesser pelvis. And this is lesser pelvics because it is located below, and true pelvics because majority of the pelvic viscera are located within this space. So it is true. So this lecture will be focusing on the true pelvics or the lesser pelvics. In this lecture also, we'll be describing the different walls or borders of the true pelvics and also the different organs that are located within it. So let's dive into the true pelvics to establish the specific configuration that it presents. Using this image here by the side, we already said that we have the pelvic brim, which is also referred to as the pelvic inlet. This pelvic brim is like a constricted rim or a constricted region around the pelvic cavity. And this is what is used to subdivide the pelvic cavity into the upper greater pelvis and the lower lesser pelvics, which can also be referred to as the true pelvics. So you see the true pelvics lying or located below the pelvic inlet. Remember that the pelvic inlet is what is demarcated here in dotted red. This pelvic inlet can also be referred to as the pelvic brim. And inferior to this region is where we have the true pelvics. And if you check the imaginary alignment that creates this constricted region can be referred to as the linea terminalis. So this linea terminalis is like an imaginary line that is drawn along this alignment that is created as the pelvic brim or the pelvic inlet. Inferiorly, this true pelvics or the lesser pelvics is bounded by the pelvic outlet. So if you also try to use this image, this is the pelvic outlet here, also demarcated in dotted red. So we can say that the true pelvics or the lesser pelvics is the space within the pelvic cavity that is located between the pelvic inlet superiorly and also the pelvic outlet inferiorly. So this is the space here that is harrowed here in white. So before driving into establishing the different borders of the true pelvics or the lesser pelvics, let's try and highlight the different structures that are seen to form the alignment of the pelvic inlet superiorly and also the pelvic outlet inferiorly. So for the pelvic inlet or the pelvic brim, using this image by the side up here, this is where we say we have the pelvic inlet here demarcated in dotted red. This pelvic inlet we say can be referred to as the pelvic brim. So if you look at this circumference, we have a number of structures that are seen to form the alignment of the circumference of the pelvic inlet, and it's good for us to establish or highlight these structures. So if you look at it from the posterior part, we have the sacral promontory, and this is what is highlighted here at this point. This sacral promontory is a protrusion that is created on the first sacral bone, and this protrusion is seen to be more prominent in male. For female, it is seen to be less prominent, and it needs to be less prominent in female so as to create more space within the pelvic inlet, of course, to allow for easy passage of the baby during birth process. For the male, there is nothing of such, so there is no need of creating space around this region. so it can afford to be more prominent. Then if you go more laterally, the next structure that is seen to form the alignment along the pelvic brim, that is the circumference of the pelvic brim. After the sacral promontory at the posterior region, we have the wing of the sacrum. And this is what is arrowed here in purple. The wing of the sacrum can also be referred to as the ala of the sacrum. And you see it like the wing of the butterfly. And this is what is seen to be arrowed here at this point. After the ala or the wing of the sacrum, the next structure that is seen is the arcuate line of the ilium. If we go back to the hip bone, we know that the hip bone is made up of 3 subunits that are fused together. At this upper part here is where we have the ilium. At the lower anterior part is where we have the pubic. And at the posterior lower region here is where we have the ischium. So if you look at this alignment around this region that is demarcated here in white, we have a prominence that is created along this medial border of the ilium. And this is what is referred to as the arcuate line of the ilium. This is the next structure that will be forming an alignment with the circumference of the pelvic inlet. Then if you go more anteriorly, the next structure that is seen after the arcuate line is the pectinal line of the pubic, and this is what is seen to be highlighted here in green. This pectinal line is like an eminence also that is created around the superior ramus of the pubic bone. We know that the superior ramus is the superior extension from the body of the pubic. Then if you go more anteriorly, the next structure that will be seen just along the midline plane is the upper border of the pubic symphysis, and this is what is highlighted here in yellow. So you see that we have an alignment on this side, and this we have highlighted. So if you go through to the other side, we'll be having also the pectinal line of the superior ramus of the pubic bone. Then the next structure will be the arcuate line of the ilium. We have the ala of the sacrum or the wing of the sacrum. Then we also have the sacral promontory. So that is how that alignment will run, of course, forming a circular configuration. So you see that you have a number of structures forming this alignment, and it's good for us to be able to establish this so that at different points or at different regions, you have a structure that is aligning with the circumference of the pelvic inlet or the pelvic brim. So going to the pelvic outlet, that will be using this lower image here to establish the structures that are seen to form the alignment of the configuration of the pelvic outlet also. We say that the pelvic outlet here is the inferior limit of the true pelvis. It's also good for us to establish or highlight the structures that are seen to form the alignment at this region. So this space here is guided by the pelvic diaphragm. And this is where we have the creation of the pelvic outlet. So the first structure that we see at the anterior part is the lower border of the pubic symphysis. And this is what is arrowed here in yellow. We know that the pubic symphysis is a connection point between the bodies of the pubic bone. So we have the body of the pubic bone on one side, and you have the body of the pubic bone on the other side, of course, forming a joint at this midline plane that is referred to as the pubic symphysis. So the inferior border of the pubic symphysis is what is seen along the anterior midline plane. Then if you go more lateral to the side, the next structure that you would see is the pubic arc. This pubic arc can also be referred to as the ischiopubic ramus. So you have this alignment highlighted here in red. So after this formation, the next structure that will be seen is the ischial tuberosity. And this is what is seen to be arrowed here in green. Then the next structure following the ischial tuberosity is the sacrotuberous ligament. And this is the sacrotuberous ligament here arrowed in black. We know that the sacrotuberous ligament is a ligament that is seen to connect the tuberosity, which is this structure here that is arrowed in green, of the ischium to the sacrum. And at this point through which it runs to and fro, the ischial tuberosity and also the sacrum, you see it also forming an alignment with the presentation that is formed by the pelvic outlet. Then if you go more posteriorly, the next structure will be the coccyx. And this is the coccyx here, arrowed here at this point. This is like the terminal bone or the tailbone that is located, of course, along the vertebral column. And of course, it is the most terminal bone that will be seen to form the alignment with the pelvic outlet. Then if you go on the other side, the next structure that you'd see is also the sacrotuberous ligament. Then this will be followed with the ischial tuberosity. Then, of course, more anteriorly, you have the pubic arc or the ischiopubic ramus. Then finally, you then have the inferior border of the pubic symphysis. So if you check this alignment all together, both from the right and on the left side, at the inferior limit of the true pelvis. And this is what is referred to as the pelvic heartlet. So now let's dive into the true pelvics or the lesser pelvics fully. And here we'll be establishing the structures that are seen to form the different borders of the true pelvics. First, we'll be looking at the anterior border. This anterior border is the shallowest border. So if you look at this configuration, this is where we say we have the pelvic inlet or the pelvic brim, which is the basis onto which the pelvic cavity is subdivided into the greater pelvics up here because it's greater, of course, above, and the lesser pelvics because it's lower or below the pelvic brim. So you have this demarcation created at this point. And if you look at it at the inferior part is where we have the pelvic heartlet, which is demarcated here in black. So between this pelvic inlet and the pelvic heartlet, we say we have the true pelvics or the lesser pelvics. And this region in the anterior part, we see that we have a number of structures located within this region. So let's try and drive in to establish the different structure within the anterior compartment of the true pelvics. So anteriorly, the structure that you have are the posterior surfaces of different subregions of the pubic bone. We know that the structure that you see in the anterior part here is the pubic bone. And we also know that the pubic bone is made up of different subregions. We've tried to highlight this in our previous lecture on the bone in pelvics. If you've not checked that lecture out, please kindly go and do so as to keep yourself updated. But of course, it is the posterior surfaces of the different regions of the pubic bone that will be forming the anterior border of the true or the lesser pelvics. So we have the bodies of the pubic bone, and this is what is seen to be harrowed here in green. The bodies of the pubic bone, we have two. We have one on the right side and we have another one on the left. It is also through the body of the pubic bone that this pubic bone on both sides are able to connect with each other at a joint that is referred to as the pubic symphysis. So you have the pubic symphysis created here at this anterior midline region. Then if you go further, we have a superior extension from the body of the pubic bone, and this is referred to as the superior rami. And this is where we have the superior ramus here on one side and the superior ramus also on the other side. So this is like a superior extension from the body of the pubic bone on both the right and also the left side. And if you go at the terminal end of this superior extension, you will see that what they form basically is the acetabulum. This is where we have the acetabulum here harrowed in black. We also have two, one on this side and also one on the other side. So you have the superior extension from one side contributing to the formation of the acetabulum on that same side. And we have the superior extension from the other side, also contributing to the formation of the acetabulum on the same side. So you have the formation of the acetabulum specifically by the superior rami on both sides of the pubic bone. Then we also have an inferior extension. So we have two inferior extensions also from the body of the pubic bone. And these inferior extensions are referred to as the inferior rami. So we also have two, and this is what is seen to be harrowed here in red. We have one on this side and we have the other one on the other side. This inferior rami are seen to form the pubic hack, and this is what is configured here at this point. This pubic hack for the female pelvis is seen to be wider. So the angulature that is created by the inferior extensions from the body of the pubic bone are referred to as the pubic hack because these extensions form arc-like configuration around the space. So for the female pelvis, it is seen to be wider, and this wideness is to create more space for the passage of the baby during childbirth process. So you see that you also have distinct differences between the different specific areas of the pelvic bone depending on the sex. Then finally, in the anterior border, the other structures that we see are ligaments. And this ligament has seen to anchor the pubic symphysis. So you have a number of ligaments, of course, around the point where this joint is formed, so as to help reinforce or strengthen this joint. So we have 4 types of ligaments in this region. We have the superior pubic ligament, and this is what is highlighted here in black. Just from mere driving into the name, the superior pubic ligament is a ligament that is seen to reinforce the pubic symphysis at the superior part. So you see it lining the superior part of the pubic symphysis. We also have the inferior pubic ligament, and this is what is highlighted here in red. This inferior pubic ligament is seen to reinforce the pubic symphysis at the inferior part. And you see it runs an arc-like configuration, considering the pattern that is formed also around this region. So it tends to follow the orientation around this region. Remember that the pubic arc is formed around this region, and it is formed as a result of the inferior extensions from the body of the pubic bone. And this arc-like configuration is also what the inferior pubic ligament also follow this alignment, and it is also referred to as the arcuate ligament. Then we also have the anterior pubic ligament, and this is what is highlighted here in purple. It is seen to reinforce the joint in the anterior part. Then finally, we have the posterior pubic ligament that is highlighted here in dotted blue, and this is seen to reinforce this joint at the posterior part. So you can see that you also have a number of ligaments in the anterior border of the true or the lesser pelvis, and this is what is captured here in this slide. So let's go further to the posterior border. What are the structures that are seen at the posterior border of the true pelvis or the lesser pelvis? So the posterior border generally is seen to be curved, and this curvature is created as a result of the pattern that the sacral bone presents. If you look at the sacral bone, it forms a curvature along its course, and that is why the true or the lesser pelvis is referred to as the curved canal. This curvature that is created by the sacral bone is also seen to help create more space around this region. So as it curves posteriorly, you see it creating more space within the true or the lesser pelvis. So let's dive in to see the different structures that are seen in the posterior alignment of the true pelvis or the lesser pelvis. The first set of structures that are seen are bones. So we have the sacrum and also the coccyx. This is where we have the sacrum here, harrowed at this point, and at the inferior part of the sacrum, we have the coccyx, and this is what is harrowed here also inferiorly. It is important to state that it is the anterior surfaces of the sacrum and also the coccyx that are seen to form the posterior border of the true pelvis. So we have these two bones, of course, forming the structural framework of the posterior border of the true pelvis or the lesser pelvis. Then another structure that is seen is muscle, and this muscle specifically is the piriformis, and this is what is seen to be highlighted here at this point. The piriformis is seen to emerge from the anterior surface of the sacrum, and you see the fibers driving down through the greater sciatic foramen. And as it passed through the greater sciatic foramen, it's seen to exit the pelvic cavity, where it is finally inserted on the greater truncator. So you see it emerging from the pelvic cavity and finally is being inserted on the upper part of the lower limb. So this is how the piriformis is seen. And because of the orientation that it runs from where it emerges from, and also where it's finally inserted upon, you see it forming an alignment with the posterior border of the true pelvis. Then the next structure is the coccygeus muscle. This coccygeus muscle can also be referred to as the ischio-coccygeus. So this is where we have the coccygeus muscle here, highlighted in yellow. You have one on this side and you have another one on the other side. This coccygeus muscle is seen to emerge from the spine of the ischium, and you see it finally inserted on the coccyx. And this is also where the name ischio-coccygeus is drafted from. So you see it originating from the spine of the ischium and inserted finally on the coccyx. So this ischio-coccygeus or the coccygeus muscle is also seen as a posterior alignment of the true pelvis. The other structure that we see around this region is the levator ani, but it's good for us to know that it is the posterior region of the levator ani that is seen as a posterior alignment of the true pelvis. If you consider the orientation of the levator ani, which of course is a structural component of the pelvic floor, the levator ani muscle presents a dome-shaped configuration or a funnel-shaped configuration, and this is what is highlighted here in this image. And because of this dome-shaped structure or pattern that the fibers run, it seems to also align with the posterior part of the true pelvis. So you have specifically the posterior region of the levator ani muscle that is seen around this space. So if you try to use this image down here, this is where we have the levator ani muscle. And if you look at the configuration that it runs, you see that it's like a dome. And if it's like a dome, It means fibers from this muscle will be extending also to the posterior region, but it's going to be the posterior part of this muscle that will be forming alignment with the posterior border of the lesser pelvis. Then finally, we have ligaments. Ligaments are also seen at the posterior part of the true pelvis. So let's try and use this image here for a better illustration. This is where we have the posterior border of the true pelvis here exposed in this image. And you have a number of ligaments also around the posterior border. So if you look at this region here, we have the anterior longitudinal ligament. This anterior longitudinal ligament is an extension from the cervical region down to the sacral region. And this ligament is seen to reinforce the vertebral column along the anterior border. So you see it also extending to the true pelvis or the lesser pelvis. If you go more inferiorly, you have the sacrococcygeal ligament. This sacrococcygeal ligament is seen to connect the sacrum with the coccyx. And this is what is harrowed here in black. Then if you go more on the lateral side, you have the anterior sacroiliac ligament. This sacroiliac ligament, it is not the entire sacroiliac ligament that is seen to form the posterior border of the true pelvis. Remember that the true pelvis is the space that is located inferior to the pelvic brim. So if you have the pelvic brim around this region, it means that the inferior region of the anterior sacroiliac ligament is what will be seen at the posterior border of the true or the lesser pelvis. So it's good for us to be able to distinct the different regions that will be seen to form alignment with the posterior border of the true pelvis. Then you also have the sacrospinous ligament, and this is what is seen to be harrowed here in blue. The sacrospinous ligament, just from here breaking down the name, as we've always said, is the ligament that connects the spine of the ischium to the sacrum. And as it runs to and fro these two subunits, you see it forming alignment with the posterior border of the true pelvis. But of course, specifically, it is the posterior region of this sacrospinous ligament that is seen to form this alignment. We know that the sacrospinous ligament is seen to transform the greater sciatic notch into the greater sciatic foramen. Considering the pattern that it runs along this space, it is seen to transform this indentation that is created around this region, which is referred to as the greater sciatic notch, into the greater sciatic foramen. Then we also have the sacrotuberous ligament that is harrowed here in brown. This sacrotuberous ligament connects the tuberosity of the ischium to the sacrum. It's also seen to transform the lesser sciatic notch into the lesser sciatic foramen due to the pattern by which it runs from where it originates from to where it is inserted upon. Also, it is the posterior region of this sacrotuberous ligament that is seen to form alignment with the posterior border of the true pelvis or the lesser pelvis. So it's good for us to be able to distinguish the specific region, because if you look at how this ligament originates and where they are inserted upon, you see that they run through the lateral border and also the posterior border. But it is the posterior region of this ligament that are seen to form alignment with the posterior border of the true pelvis, and this is understandable. So now going to the lateral border. The lateral border of the true pelvis or the lesser pelvis is formed by the hip bone. This is the configuration of the hip bone here. We have two. We have one on the right and one on the left. And we know that structurally, the hip bone is made up of three subunits. We have the ilium. This is the ilium here, harrowed here at the upper part. At the anterior part, we have the pubic, and at the inferior part here, behind, we have the ischium. It is good for us to know that the bulk of the lateral border of the true pelvis is formed mainly by the pubic and also the ischium. It is just a little that the ilium will contribute to the formation of the lateral wall of the true pelvis. The bulk of the ilium is seen to form the bulk of the greater pelvis above. Because if you create a constriction around this point, so this is where we have the demarcation here created. And if you see where this demarcation is created, you will see that the bulk of the ilium is seen to form the major contribution to the formation of the greater pelvis, which is the space that is located above the pelvic brim that is demarcated here in blue. Then the next structural component that we have around the lateral border of the true pelvis are the obliterator internus muscle. We have the obliterator foramen, we have the obliterator obliterator membrane and also the obliterator canal. So let's dive into this to see how these structures are related and also how they are formed around the lateral border of the true pelvis. So if you look at this configuration, there is a foramen that is created around the hip bone in this lateral part, and this is what is harrowed here in red. This foramen is created by rami. So let's dive in to see the different rami that contribute to the formation of the obliterator foramen. So this obliterator foramen, we say it is harrowed here in red. So let's try and use this hip bone on the other side to illustrate how the obliterator foramen is formed, because that is the basis onto which we'll be driving on to expatiate on the obliterator membrane, the obliterator canal, and also the obliterator internus muscle. So if you look at this other side here, this is where we have the superior ramus of the pubic bone. Remember that the pubic bone here, this is the body. We say that it is through the body that it connects with the body of the second hip bone to form the pubic symphysis. And of course, superior extension from the body is the superior ramus. We also have an inferior extension from the body that is called the inferior ramus. Then finally, we have the ramus of the ischium that is also arrowed here at this point. The ramus of the ischium is the extension from the body of the ischium, and this is what is arrowed here at this point. So you see that it is a combination of the rami from the two bones that are seen to be located around the space. So we have the superior ramus of the pubic bone, we have the inferior ramus of the pubic bone, then we have the ramus of the ischium. So these three rami are seen to form the alignment of the obliterator foramen. So this is where we have the obliterator foramen here at this point. This obliterator foramen is incompletely covered by the obliterator membrane, and this is what is highlighted here at this point. Because of this incomplete covering of the obliterator foramen by the obliterator membrane, there is the creation of the obliterator canal, and this is what is harrowed here at this point. You can see how a foramen is being transformed into a canal by a membrane. So this is what is seen to be established here at this point. And this obliterator canal is not created for fun. It is created to allow for the passage of the obliterator vessel. So you have the obliterator nerve, which is a branch from the lumbar plexus. You also have the obliterator artery, which is an emergence from the internal iliac artery. Then you have the obliterator vein. So you have these vessels, of course, passing through the obliterator canal. So that is how we have the establishment of this component around the lateral border of the true pelvis. We also have the obliterator internus muscle. So let's see how the obliterator internus muscle emerges. So from the posterior wall or the posterior border of the obliterator membrane and also the posterior border of the obliterator foramen. Remember where the obliterator foramen is and also where the obliterator membrane is covering. So these two structures, the posterior surface of these two structures is where we have the emergence of the obliterator internus muscle. And this is what is highlighted here in dotted red. So this obliterator internus muscle would emerge from the posterior surfaces of the obliterator membrane and also the obliterator foramen. Then you see it passing through the lesser sciatic foramen, and that is how it finally exits the pelvic cavity before you then see the fibers inserted on the medial side or medial region of the greater truncator. So this is how the obliterator internus muscle originates, and of course, passing through the lesser sciatic foramen and finally inserting at the upper part of the lower limb. And this muscle is also taken as part of a structural component of the lateral wall of the true pelvis. We also have ligaments, and the two ligaments around this space are the sacrospinous ligament and also the sacrotuberous ligament. Remember in our previous slide, we also tried to highlight this ligament as part of the structures that are related to the true pelvis posteriorly. We said that considering the pattern by which they run an alignment laterally and also posteriorly. So if you try to use this image down here, this is where we have the sacrospinous ligament that is highlighted here in blue. This ligament emerges from the spine of the ischium and is inserted on the sacrum. And as you see it running to and fro, you see that it runs a lateral course and also a posterior course. So specifically, it is the lateral region of the sacrospinous ligament that is seen to form an alignment with the lateral border or wall of the true pelvis. We also have the sacrotuberous ligament here at this inferior part that is harrowed here in brown. The sacrotuberous also emerges from the tuberosity of the ischium, and you see it inserted on the sacrum. And as it runs to and fro this region, you see it running a lateral course and also a posterior course. But specifically, it is the lateral sub-region of the sacrotuberous ligament also that will be forming a structural component of the lateral wall of the true pelvis. So it's good for us to be able to establish the specific regions of this ligament that are seen in the different borders of the true or the lesser pelvis. So finally, after establishing the different structures that we have in the anterior, posterior, and also the lateral border of the true pelvis, at the superior part, you see that it is limited by the constriction that is referred to as the pelvic brim, and this is what is highlighted here at this point. Then inferiorly, we have the pelvic floor or the pelvic diaphragm, and this is what is seen at this point. So at the pelvic outlet, you see the pelvic outlet is guided or covered by the pelvic floor or the pelvic diaphragm. This pelvic floor is a collection of muscles that are locked up together at this region. So we have the levator ani muscle and also the coccygeus muscle. We say that the coccygeus muscle can also be referred to as the ischio-coccygeus muscle. We've done a lecture on the pelvic floor also. If you've not checked that lecture out, please kindly go and do so as to keep yourself updated. And of course, between the constriction above and also the limitation below that is created by the pelvic floor, we have the true pelvis. So now driving through the content, what are the structures that are seen within the true pelvis in both the male and the female? So let's try to create the alignment here in dotted black. We say that this imaginary line is drawn from the upper border of the pubic symphysis to the sacral promontory. Remember when we started this lecture, we tried to create an alignment or different structures that are positioned around the circular alignment that is referred to as the pelvic inlet or the pelvic brim. We say that in the anterior part, we have the upper border of the pubic symphysis, while posteriorly we have the sacral promontory. So if you try to draw this alignment using this dotted line to create this imaginary configuration, we say that this dotted line can be referred to as the linea terminalis. Anteriorly, the first structure that is seen is the urinary bladder. This is the urinary bladder here, heralded in blue. This urinary bladder, when distended, can move to the greater pelvis because there's going to be an increase in size due to more accumulation of urine. So it may be seen to extend up into the greater pelvis. Then the next structure is the ureters. We have two ureters, which of course are seen to carry urine that is produced in the kidney, delivering it into the urinary bladder, where to be temporarily stored. And this is what is highlighted here in red. We have one on both sides, of course, releasing urine through the posterior border of the urinary bladder. So this is one of the structures also seen within the true pelvis. Then we have the urethra. This is the urethra here at the exit of the urinary bladder, and this is what is seen to take urine out and deliver it to the external environment. Then posteriorly we have the rectum. This is the rectum here, heralded in green. We know that the rectum will become continuous as the anal canal that is heralded here in purple. So these are the number of structures that we see within the true pelvis in both the male and also in female. So let's try and drive in specifically to male. What are the distinct organs that we see in the true pelvis of the male? So first, let's try and create the alignment, the linea terminalis, from how it is established in our previous slide. And this is what is highlighted here in dotted black. So the first organ that is seen within the lesser pelvis in male is the prostate gland. This is the prostate gland here, heralded in red. The prostate gland is seen to be located at the exit of the urinary bladder. So you see it within this space and is also located within the lesser pelvis. Then the next structure is the seminal vesicle, and this is what is seen to be captured here in blue. This seminal vesicle is also seen to release its secretion into the semen. We also have the vas deferens. This is what is highlighted here at this point. This is what is bringing semen from the testes. And at this point, you see it connecting with the dot of the seminal vesicle, where it now becomes the ejaculatory dot. And this is the ejaculatory dot here, highlighted in yellow. This ejaculatory dot is also seen within the true pelvis. This ejaculatory dot is also seen to deliver semen into the prostatic urethra. We know that the prostate will also release its own content into the semen before it is finally released into the membranous urethra, then finally through the penile urethra before it will be released to the external environment. So these are the number of structures that are distinct for the male true pelvics. So for the female true pelvics, the structure that we see also forming this alignment first that is captured here in dotted black, we already know the orientation of this linear terminalis. So the first organ that we see is the uterus. This is the uterus here at this point. The next structure that you would see is the vagina, and this is what is arrowed here in black. You also have the uterine tubes, which are 2 in number, and these are tubular extensions from the uterus. This structure or organs are not projected in this image. You also have the ovaries also located within the true pelvics or the lesser pelvics. And this also is not shown in this image because they are positioned at the lateral end. Then let's quickly go to applied anatomy. And the applied anatomy we want to look at is the pelvic inlet that is also referred to as the pelvic brim. And this pelvic brim is used for pelvimetry measurement. And this is the region here captured here in dotted red. We have a number of evaluations that is measured across this space. We have the anterior-posterior dimension, we have the oblique dimension on the right, we have the oblique dimension on the left, and we have the horizontal or transverse dimension. All these dimensions are taken into consideration and they are used to estimate whether the birth process will occur through the vagina or other means of birth will be considered. So let's check our understanding of this lecture through the following question. And the first one is, the posterior border of the true pelvis is formed by what? We've tried to highlight that we have a number of structures forming the posterior alignment of the true pelvics. And the second question is, list the structures that align with the lateral border of the true pelvis. This we have also highlighted during the course of this lecture. And the next question is to highlight the content of the true pelvics. We've also highlighted this during the course of this lecture. And also going further, specifically stating the ones that are peculiar to the male and also the female. Then the last question is, what structures align with linear terminalis? So thanks for spending your time watching this video.